the Light phototherapy system, delivering the true science of light-emitting diode low-level light therapy. We turn Light on and off with this switch here. When we turn Light on, the GUI lights up, and after a few seconds it displays all the information that you need to set the system up. When everything finally comes up and the screen lights up, you can see that on the left we have the wavelength. You can see the system starts in standby mode by default. Standby is displayed here. The dose in joules per square centimeter is displayed here, and you change the dose up or down using the arrows on either side to get the dose that you want. Above the dose you will see a timer, and that tells you how long the system will run to deliver that particular dose. The next thing that we can set is the intensity or the power level, and that's set from this little control here on the right, and it goes from 1, which is minimum, up to 4, which is maximum. Before starting treatment, it's important to set up the head at the right distance from the target tissue. This should be between 17 and 20 centimeters. That's the optimum distance to get the best effect from the LEDs. Then the other thing we have to do is to adjust these panels so that they are facing the contour of the face. There we go. Very nice. Now we're delivering equal light to all parts of the face, even though it's a curved area. Moving from the shorter wavelengths to long, the first head we'll look at is the 450 nanometer blue head. The first thing we want to see is how this wavelength will interact with blood, with melanin, and with water. And as you can see, it's very highly absorbed in melanin and blood, and this limits the penetration of this wavelength into tissue, but there are no active chromophores in these targets for this wavelength. To give you an idea of how deeply it penetrates, you can see that at that wavelength we can reach the sebaceous glands, and that's important because the main biological target for 450 nanometers is porphyrins. Active Propionibacterium acnes, or P. acnes, the causative bacterium of inflammatory acne, when it is active it contains protoporphyrin 9, PP9, and coproporphyrin 3, CP3. These are porphyrins. So when we run action spectrum for these two porphyrins, we can see that there is a huge peak at 415 nanometers that activates these porphyrins and helps us to kill Propionibacterium acnes through endogenous PDT, photodynamic therapy. In fact, the only indication for the Light 450 nanometer head is as a component of LED phototherapy for active inflammatory acne. However, the 415 head cannot be used alone. It must be used in combination with the 830 nanometer or the 633 nanometer heads to treat the inflammation and heal the wounds, which are also part of inflammatory acne. The next head we will look at is the 633 nanometer visible red head. And again we can see where this interacts with the biological pigments. It's the same wavelength as the helium neon laser, and therefore there is a wealth of good data on how this system interacts with tissue. There is lower absorption in melanin than at 450 nanometers and much lower absorption in blood, so this will allow much deeper penetration. The active chromophore is mitochondrial cytochrome C oxidase. And as you can see, penetration of 633 nanometer goes through all layers of the skin and into and even beyond the subdermal layer. Penetration depth can be up to around 3 centimeters. Prior to the 830 nanometer LED LLLT development, 633 nanometer was the wavelength of choice for wound healing, pain relief, and all anti-inflammatory applications. The current use of the Light 633 head includes hair regrowth and together with 415 nanometer for inflammatory acne, but the main indication is activation of aminolevulinic acid, 5-ALA, in exogenous photodynamic therapy, PDT. So once again, here's the action spectrum for protoporphyrin 9, the main porphyrin for 5-ALA. And yes, there is a very large activation peak at 450 nanometers. However, penetration is extremely poor and the activation is extremely painful. Down here at 633 nanometers, although we have a lower curve, we have good penetration and much more gentle activation. So this makes the Light 633 nanometer head ideal for gentle and deep activation of aminolevulinic acid in exogenous photodynamic therapy, PDT. And this can be used for non-melanoma skin cancers. It can be used for actinic keratosis, single-session treatment for active acne, and single-session treatment for skin rejuvenation. However, these latter two are very much no pain, no gain, but the results are excellent. The final Light head, and the most versatile, is the 830 nanometer near-infrared head coupled with 590 nanometers. At 830 nanometers, we have lower absorption in melanin and in blood, and we get deepest penetration. The main biological targets are multiple: cellular membranes, vascular and lymphatic endothelium, and neural axons. At 590 nanometers, we have very, very poor penetration because of high absorption in blood and melanin. And the main targets for this wavelength are mother keratinocytes and Merkel cells in the epidermis. Deep penetration of 830 gives us the deepest among all the wavelengths, through the skin and subdermal layer and into the deep tissues. There is even penetration through bone. The penetration depth is approximately 8 centimeters. And we compare that with the 590 nanometer wavelength. It involves mainly the epidermis and the very, very superficial papillary dermis, with a penetration depth of less than 1000 micrometers. However, the indications are multiple. Wound healing for both acute and chronic wounds, traumatic wounds, surgical wounds, ulcers of all etiologies, and burns. Pain attenuation for pain of all types, acute or chronic, musculoskeletal or neurogenic. Bone regeneration for even slow union fractures, and ideal for osseointegration of implants or prostheses. We can also find wonderful use for nerve regrowth for transected or crushed nerves in all aspects of sports medicine, including accelerating return to play, for skin rejuvenation, for hair regrowth, and together with 450 nanometers, an excellent phototherapy for acne. However, there is one thing that is unique to Light 2, and that is photosequencing technology. Here we have the full planar array of Light with the end-on view of the 5 panels. You can see the LEDs, and the 4th LED in from the edge of each panel is a dual chip LED containing also a 590 nanometer diode. You can see on this contoured target, when we turn the system on for the first time, we get this cycling of yellow, 100 microjoules per square centimeter per panel. The target tissue is mainly the epidermis, and in particular the mother keratinocytes and Merkel cells near the stratum basale. In that first minute, we can see significant extracellular ATP production and signaling compounds, calcium ions and protons, and these are released extracellularly, benefiting the epidermis. Cytokines also drop down into the dermis, preparing dermal cells for action once the 830 nanometer energy arrives. After that first minute, all of the 830 nanometer LEDs are activated, with an irradiance of 100 milliwatts per square centimeter, several orders of magnitude greater than the 590 LEDs. The dose is 60 joules per square centimeter. But you'll notice that the 590 LEDs keep on cycling, but now clinical efficacy is totally washed out. The main advantage, of course, is that 830 nanometers is near infrared and therefore is invisible. And because the yellow 590 LEDs keep cycling, the patient can see that something is actually happening. As said before, there are multiple targets for this wavelength. They are all the wound healing cells, autonomic, motor and sensory nerves, blood vessels, lymphatic vessels, muscles and bones. And this is why Heal Light 2 is a new concept in LED LLLT. So as you see, the yellow, the 590, is scanning panel by panel. And during this first 1 minute, the target is only the epidermis, and in particular the cells that keep the epidermis healthy. Then when the 830 nanometer wavelength kicks in, you won't be able to see it because it's infrared and invisible to the human eye. But when that wavelength comes in, then it deals with all the cells in the deep dermis, and that's good for photorejuvenation, it's for pain attenuation, for wound healing and wounds of all types. Heal Light needs very, very little in the way of care and maintenance. In these times of COVID-19, you can wipe down the body of the system and the top of the head using a dilute antiseptic or antibiotic, and in non-COVID times you can use a dilute detergent. Make sure that you don't over-soak the system, and always turn the system off when you're cleaning it. As far as the OLAT panels are concerned, you can wipe them down with an alcohol swab, and that will keep them completely clean and germ-free. When you move the system from any treatment room to another treatment room, always unplug the system from the wall and from the system itself, and always use the handle when you move the system. Do not move the system using the handles on the panels or using the articulated arm. That's it. Thank you very much indeed for watching.